COVID-19 is a highly contagious virus that affects people all around the world. It has numerous negative economic consequences in every country. Today, my group and I will talk about how COVID-19 influenced every aspect of our country.
COVID-19 pandemic in Malaysia is part of the current worldwide pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome coronavirus 2. The medical response and preparedness to the outbreak in Malaysia are overseen by Director General of Health Nur Hisham Abdullah. The first cases in Malaysia were confirmed among travelers from China in Johor via Singapore on 25th January. The most known was a Tabligh Jamaat religious gathering in Kuala Lumpur, which caused a massive spike in local cases and imported cases in neighboring countries. By the end of March, the total number of cases had risen from below 30 to a staggering 2,000 active cases across every state and federal territory in the country. In response to rising cases, Prime Minister Muhyiddin Yassin imposed a nationwide lockdown known as Movement Control Order, which came into effect on 18 March. By early May, this MCO lockdown had led to a gradual decline in daily infection. In response, the Malaysia government progressively relaxed lockdown restriction in a staggered phase, beginning with the CMCO on 4th of May, followed by RMCO on 10th of June 2020.
The implementation of the MCO. Following the implementation of the MCO, only essential economic and services sector are allowed to operate during MCO with strict adherence to SOP. Interstate travel remains banned nationwide. All Malaysia were instructed primarily to stay indoors. The early management of COVID-19 in Malaysia prior to the MCO was challenging. Initially, the reporting of COVID-19 was classified as an influenza infection due to the concurrent winter season in the northern hemisphere countries together with the movement of people during the end of year holiday season. Based on this presumption, although initial precaution had been implemented by the Ministry of Health, earlier action identified people who were at risk and those with influenza-like illness to be screened and further managed. Flattening the curve. Whilst Malaysia's decision to implement the MCO was slightly later compared to other affected countries such as South Korea, the result of this implementation had surprised many. With concurrent onset of the COVID-19 cluster, the government needed drastic intervention to prevent the prediction from becoming reality. The approach taken by Malaysia had been based on the past experience from China and South Korea. This may not have been a suitable option for Malaysia. The nature of Malaysia, who are more sociable and have an affinity for social gathering, might pose as a difficult challenge should the complete lockdown be imposed. The Minister of Health and the government designed a combination of MCO measure and targeted screening approach to be using during the mitigation phase. This was to create a small window of opportunity aiming to break the transmission chain of the virus.
There are three parties involved during COVID-19 pandemic in Malaysia. Firstly, government. Secondly, frontliners. Thirdly,
citizens. The government have had banned all the gathering, including international meetings, sporting events, social and religious assemblies. Government implemented the MCO to address the coronavirus outbreak under the Prevention and Control of Infectious Disease Act 1988 and the Police Act 1967. The Malaysian government announced a stimulus package worth 20 billion to enable the tourism and other industries, and 25 billion will be provided to help families and business owners in country to deal with the impact of COVID-19 pandemic. Government also give a mandatory to use face mask in public. To impose restriction, the police force was deployed across the nation in patrolling vans and foot patrols from first day of lockdown. Most police forces achieved success in position of lockdown through strict access control and movement restriction without the use of cohesive force. The healthcare employees need to work day and night in order to help the government against the virus. They have to sacrifice their own safety and health to make sure the virus can be stopped from spreading. These citizens have the easiest task is to stay at home to break the spreading of the virus. They need to adhere all the instructions from the government to stop the COVID-19. And for suggestion to reduce of the risk of getting infected against the COVID-19, no handshaking and kissing on the cheek, cleaning hand distance at least 1 meter. Besides that, avoid sharing objects and touching surface in public. And most important thing is wearing a mask when in public to prevent from being infected and bring others to be infected. Thank you.
So, for the conclusion, as we know that the COVID-19 epidemic began spreading in the country on January 25, 2020, after visitors from China who entered the country through Singapore were verified to be infected. Prime Minister Tan Sri Muhyiddin Yassin said on March 16 that the government had decided to enforce the movement control order across the country from March 18 to March 31. This movement control order includes first and foremost a nationwide restriction on movement and public gathering, include religious, sports, social, and culture events. For me, in the worst case scenario where the company is forced to reduce their staff due to economic difficulties, as we know that many company business has turned down due to COVID-19, so will make a lot of people jobless and it's kinda hard for them to find a new job. Our country is now in phase MCO 3.0 due to an increase in COVID-19 transmission cases to 6,440 as a result of people's unwillingness to follow the SOP. So, in my opinion, COVID-19 cases in Malaysia will be expected to decrease if the people follow the SOP properly.